Welcome to this unit on AI and the digital divide. By the end of this unit, you will be able to outline issues of AI and the digital divide. The digital divide. The digital divide refers to the unequal access to and use of information and communication technologies. The digital divide is a key challenge to the adoption of AI for health. It can produce disparities and challenges that affect the use of AI, and AI itself can reinforce and exacerbate the disparity. The digital divide is not just an issue between countries. It can impact groups within countries by geography, culture, religion, language, age or generation, gender, and socio-economic status. For example, 1.2 billion women in low and middle-income countries do not use mobile internet because they cannot afford to or do not trust the technology, whereas 327 million more men are using these technologies, indicating a gender-based digital divide. In terms of healthcare, this means that women have reduced access to the increasing number of health-related services powered by AI technologies. The human and technical resources required to use digital technologies to their full potential are also unequally distributed, and the infrastructure to operate digital technologies may be limited or inexistent. For example, some technologies require an electricity grid and information and communication technology infrastructure, such as internet connectivity, wireless and mobile networks and devices. Solar energy may provide a path forward for many countries if the climate is appropriate, as investment is increasing and the cost of solar energy has decreased. Nevertheless, at present, an estimated 860 million people worldwide do not have access to electricity, including 600 million people in sub-Saharan Africa, and there is growing pressure on the electrical grid in cities due to urbanization. Even in high-income economies, with near-universal electrification and enough resources, the digital divide has persisted. For example, in the USA, millions of people in rural areas and in cities still lack access to high-speed broadband services, and 60% of healthcare facilities outside metropolitan areas also lack broadband. Even as countries overcome the digital divide, technology providers should be required to provide infrastructure, services and programs that are interoperable so that different platforms and applications can work seamlessly with one another. Affordable devices that do not require consumers to trade privacy for affordability, thereby accommodating for the right for equal access to technology. This will ensure that the emerging digital healthcare system is not fragmented and is equitable. You have now completed Unit 2 of Module 4, Ethical Challenges. In the next unit, we will look at AI and data.